Hello, let's talk about patient preferences in randomized controlled trials. To begin this talk, we must ask, what is a preference? A preference is defined as a greater liking for one alternative over another or others. In a healthcare context, a preference can be expressed by a patient regarding many elements in the care they receive. If we focus on treatments, a patient can express a greater liking for one treatment option over another. Alternatively, a patient can express a dislike for one treatment option over another. The concept of patient preferences is built around the notion that patients have insight to the experience of their health condition, and their preferences need to be valued when making any treatment decision. There are many considerations for a patient when making a treatment decision, each with different trade-offs for the patient. A patient may wonder about the safety of a treatment, whether a treatment will help them get better, whether a treatment has certain side effects, and the overall compatibility of a treatment with their lifestyle. Ultimately, there are many questions a patient may have regarding a treatment, and their treatment choice should be aligned with their preferences. Luckily, there are already ways to measure patient preferences. Preference-based methods can help us quantify patient preferences by adding a value weight to the relevant trade-offs. Let's look at an example of how a preference-based method can be used to elicit preferences. You're trying to buy a new phone. What matters most to you? Is it the battery life, the camera quality, the cost? Would you be willing to trade off one of these for another? These different variables are called attributes. In a stated preference method, such as a discrete choice experiment, individuals are asked to state, rank, or rate their choice of these attributes over sets of hypothetical alternatives. A researcher can try to determine which of these attributes are most important to a participant by showing them multiple scenarios. By doing this, the relative importance of each attribute can be calculated. In a healthcare context, patients deciding on a new treatment option must consider the different attributes. Let's look at an example. You are a patient with rheumatoid arthritis who has high disease activity. You are presented with two hypothetical treatment options. The first treatment is an injection and has a high chance of improving your health quickly, but also presents a high risk of a major side effect. The second treatment is in pill form, has a lower risk of a major side effect, but also has a lower chance of improving your health quickly. In this case, the attributes are the risks, benefits, and treatment delivery. This is just one example of how a preference-based method can be used to elicit patient preferences. Ultimately, these methods provide us with valuable information on patients and their preferences. We have talked about the importance of patient preferences and how to elicit these preferences by using preference-based methods. So where is the gap? To understand this, we must look at the process of a clinical trial. Preference-based methods have been most applied in the interpretation stage of a trial, that is, after the trial has been conducted and the evidence collected. However, there are decisions when designing clinical trials where the evaluation of patient preferences may lead to improvements in how evidence is generated. For example, consider when patients with rheumatoid arthritis and their doctors are trying to reduce treatment. One consequence is that some patients may have a flare or an episode of increased disease activity. If this happens infrequently, people may decide that the benefits of reducing their medication outweigh the increased risk of flares. Deciding what infrequently means is challenging. In a recent randomized trial of treatment reduction in rheumatoid arthritis, the researchers chose a 20% increase in flare as an important difference because they thought it would balance well with reducing treatment. However, it is not clear to what extent this reflects patient preferences. Patient preference methods could provide a tool to inform these decisions through the eyes of patients. We are interested in interviewing different groups of people, including patients, clinicians, and researchers, to explore how preference-based methods are understood in the context of clinical trials. Your input will help us develop guidance on ways to include the patient voice in clinical trials within rheumatology. Thank you for watching. We hope you found this information valuable.